Welcome to Perspectives of People with a Chronic Disease on Participating in Work. We're glad you're here. My name is Angie Hunt, Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to WWDPI. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. Our presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed the direct links for all of these items when they're available. As I mentioned, my name is Angie, and I'll be moderating the webinar and Q&A session. Our presenter today is Marloes Vooijs. Marloes is a researcher at the Coronel Institute of Occupational Health, Academic Medical Center, Amsterdam, the Netherlands. Her research focuses on supporting work participation of people with a chronic disease. The aim of her research project is to support work retention and return to work by providing occupational health professionals with information to optimize their guidance and assessment of individuals with a chronic disease. And now I'll hand it over to Marloes.
Well, thank you, Angie, for your introduction. And at first, I would like to thank you, the Work Wellness and Disability Institute, for inviting me to speak about my research. And also, I would like to welcome all people listening to this webinar. My research concerns supporting work participation of people with a chronic disease, in which I will tell you about in this webinar, in which I, of course, mainly focus on the perspectives of people with a chronic disease. Well, as stated, my name is Marloes Vooijs. You can see my picture on the right, so you can all see how I look like in real life. I'm also part of a research team. Maybe you notice the names from other research projects. Daniel Bosse, Jan Hoving, Haaye Wind, and Monique Vrinksterese, all focusing on research concerning people with a chronic disease and how to enhance their work participation. I'm based in the Netherlands, which is a country in Europe, and I work in Amsterdam. Maybe for some people familiar, for some people not. You can see the flag stating in Amsterdam. It's the main capital, and I work at the Academic Medical Center and the Department Coronel Institute of Occupational Health. We focus on both enhancing work participation of people with a chronic disease as preventing people from getting ill from their work. But my research focuses on the first part of it. In this webinar, I will give you a short introduction of working with a chronic disease, my research concerning this and how to enhance the work participation, and then I will mainly focus on the article and explanation of it, like concerning perspectives of people with a chronic disease, in which I will close with recommendation for practice and recommendation for further research. So first, working with a chronic disease. Maybe you already know information, but I like to start with some numbers and definitions. The definition we used for chronic disease is an irreversible condition and a long duration and generally slow progression. We took the definition of the World Health Organization. We noticed that there is no formal definition, but as we aim to conduct research which helps a large group of people, we took a fairly broad definition. We aim for this as, or for the support of people with a chronic disease as you might know, more than 50% of the world is faced with a chronic disease, one or more chronic diseases, of which examples are osteoporosis, heart disease, arthritis, diabetes, cancer, etc. The World Health Organization has 4 main types, which are heart diseases, cancer, diabetes, and pulmonary diseases. And we conducted a research in a large group of people, a large group of patients, in which we asked which complaints they experienced. And people experience mainly fatigue, pain, long time to recover, sleeping problems, concentration problems. They have a slow start in the morning. Also, their mood is affected. They have frequently memory problems, and so on. But fatigue is the main component of their fatigue and pain is the main component of their complaints. I want to go back for a second. These aspects were all questions throughout various diagnoses, and we saw that many of the complaints were experienced in different diagnoses. So in this, also in the next slide, I use this picture as an overview. Also factors as age, sex, environment were found to affect the ability to participate in work, and therefore we aimed in our research to evidence independent of diagnosis. As I stated, many complaints and factors are similar amongst different diagnoses, and therefore our goal was to obtain an overview of evidence independent of the specific diagnosis. So really gain overview of factors, interventions, and also the perspectives of people with a chronic disease on how to support work participation without focusing on a specific diagnosis. We did that as we know and see that people want to work, they value work, even though they experience limitations. We saw that in the study of Waddell, and also performed an own study in which we performed, in which we see that income or financial independence, but also social contacts, making myself useful, developing and using talents is highly valued by people with a chronic disease, and need support to participate in work. So if we summarize this, having a chronic disease negatively affects participation in work due to limitations, or it generally does. Not everyone experiences limitations. And however, people want to participate in work, therefore we focus on how to enhance participation in work. So concerning my research, we aim to provide knowledge to occupational health professionals to optimize their guidance and assessment, to people with a chronic disease to participate in work. And as I explained, we provide knowledge independent of a specific diagnosis in our aim to support work participation of people with a chronic disease. And to explain you the situation in the Netherlands, we have two types of occupational health professionals. We have occupational physicians and insurance physicians. The occupational physicians are in place in the first 2 years of sick leave or experiences in work. They guide patients, they give advice on how they can retain work or return to work. And after 2 years of, because the employer has to pay the first 2 years of sick leave, and then they are a match with occupational physicians. And after 2 years, insurance physicians are responsible for the evaluation of the workability of people with a chronic disease. So we provided research and wanted to provide information for those two occupational health professionals. You see a behavior change wheel, which is a method to characterize and design behavior change interventions, in which we start with the gray circle. We aimed, the gray circle are methods to provide knowledge, and we summarize the evidence into a guideline, which you can see on the left side. And we aimed to, if you look on the green circle in the middle, we aimed to increase the capability of occupational health professionals. So providing them with knowledge how to optimize work participation. And therefore, we conducted a first study in which we searched factors influencing work participation, which factors, irrespective or independent of diagnosis, influence work participation negatively or positively. Well, you can see it in the picture. And we mainly found work-related factors and personal factors influencing the work participation, and characterized according to the ICF model. We saw that comorbidity negatively affects work related to body function. Having a higher dysfunction or a lower dysfunction, positively affects work participation. Having complaints less than 1 year has a positive effect. Related to environment, having a stimulating and supporting work environment is helpful to support work participation. Also, having a shorter sick leave than 1 year is positively associated. And related to personal factors, having an older age, being female, having a lower education, negatively affects work participation. And having an own positive prediction of return to work positively associated with work participation. You can find this if you search my name. This is a review, focuses, as I told you, on independent of diagnosis. And it's also, you can find the interventions. We thereafter search for which interventions are effective to support people in their work, also independent of diagnosis. And we found that changes in the workplace can really affect the workability or the work participation. We did a broad search, so we did not find any personal interventions or other interventions, also no financial interventions were found, only work-related interventions. So changes to the equipment, work design, work task, work organizations, work conditions were effective, and also having case management with the worker and the employer really helps. Also, having early contact with the worker by the employer really helps, because they maintain the bond with work. Having the healthcare provider having contact with the workplace and really adjusting the workplace to the individual helps. And well, this is stating quite the same: redesign of work schedules, work organization, work environment, assistive technology, assistive others, colleagues, people at home. Having transportation to work really helps to maintain work or return to work. So if we apply this knowledge to a case to really learn what it means in practice, I took a case from one of the occupational health professionals I spoke to, which is Jill, a woman of 51 years old. She has arthritis. She has pain in her hands and feet, is faced with morning stiffness, lack of energy, has difficulty focusing due to cognitive problems, and struggles with accepting the chronic disease. So if we look at this case, and we know the factors which negatively or positively influence work participation in the interventions, we can see what we can do for Jill. Further on, Jill works as a nurse. She has a good relation with colleagues, a quite formal relation with her supervisor, and she is unfortunately on sick leave due to difficulties in performing work task. If we look at the factors, there are multiple factors which can influence Jill's work participation. She has limitation due to the chronic disease, but also her relation with the supervisor and her struggles with acceptance. The struggles with acceptance do not come, are not found in the review, but are found in the article on perspectives of people with a chronic disease. So we will hear about that later on. And if we look at the interventions, we could maybe help Jill with redesign work schedule, maybe adding moments of rest. We also found that one in perspectives of people with a chronic disease. Maybe insert adaptations to the work environment, adding a case manager, as we found in the systematic review on interventions, having colleagues to assist her with work tasks, and we found that implementing interventions as early as possible, as we found in the systematic review on interventions, is important. So now to the main focus of the presentation: what can Jill do herself to enhance her participation in work? So therefore, to research that part, we performed focus groups on perspectives of people with a chronic disease. Which solutions do they have to maintain work, return to work, and what support do they need to find and use solutions to maintain work participation? Well, as stated, we use focus groups, and because to really facilitate the consciousness of individuals of their own use solutions. We noticed that not all people were conscious of the solutions they used on daily or frequent basis, and by listening to other people, they became conscious of the solutions they used. Well, we included people with a chronic disease as our research really focused on solutions, factors, interventions, independent of diagnosis. So we made sure that we had people of different types of diagnosis, and they needed to work or actively looking for work, so that they were able to tell about solutions or needed support in their work or in finding work. And we performed the recruitment via GPs and patients associations, which were really helpful. We included 90 participants as we performed focus groups until data saturation. Of those 90 participants, there were 10 men, 9 women. The average age was 50 years old, with a range of 28 years to 62 years old. 14 of them had employment or were self-employed, and 5 of them were actively looking for work. And as you can see, there was quite a wide range of diagnoses included. Rheumatic diseases, kidney disease, whiplash, visual impairment, psychological complaints, heart disease, Lyme disease, chronic back problems. I don't even know how to pronounce the next one. Diabetes and dystrophy. We made sure that we, as we wanted a range of people with different types of chronic diseases, that there were a maximum 3 people per type of diagnosis included in the focus groups, so that we could obtain the range. We first asked for the solutions they used to participate, in which we found that, first of all, acceptation. We found out through various focus groups that acceptation seemed like a very important solution to have the space to implement other solutions. It seemed like a first step for people to really have headspace for other solutions to implement. They also needed to learn how to cope with their chronic disease, so that they were able to know their boundaries and know what they were able to do in their working life. Well, some people said that they started from scratch to rebuild their life, and some people said that they focused on what they could still do. As you can see in the quote, they focused. This person focused on what they can do instead of what they can do. But there were also people who said they said they accepted a chronic disease, but they mainly focused on work and had a huge lack of energy when getting home. So they coped in a different way by putting their energy in work. As I said, also a huge part is having insight in what they can do and what they are able to and what their limitations are. And they really needed to learn that by experiencing their boundaries, just performing work tasks. And when hitting a boundary, they knew for the next time that was too much. So really just trial and error, basically. And one person said, it's mainly about finding your own limits. The saying goes, once bitten, twice shy. Well, I think I've been bitten at least 10 times already. I think everyone knows that in personal life, even without chronic disease, but this is a huge part for people with a chronic disease too, because they have to experience this process all over again in finding out who they are and what they are able to do, and accepting the new abilities and limitations. Also, a communication of the chronic disease to the work environment, like disclosing the chronic disease. Some people had the solution to disclose the chronic disease. Some people actually had the solution to not disclose the chronic disease. They had bad experiences of telling people that they are faced with a chronic disease, in which they decided to just cover their limitations. But the people who felt safe to disclose their disease really had the room for other solutions to implement as well, like the work adaptations and having colleagues to help them. And the people who felt not safe to disclose their disease really experienced a lot of limitations due to the chronic disease. Also, learning their boundaries first, which is related to what I just told, but also communicating those boundaries to colleagues and the supervisor really helped them, as a person said, that the expectations were set due to the communication of the boundaries. People knew what they were up to, were faced, and therefore it really helped in the contact with their colleagues and supervisor. And one person said, whenever I work too long, my supervisor says, time to go home. Then she simply says, since you've worked half an hour more today, tomorrow you can leave half an hour earlier. So now she really is the one who sets my limits. So she has a really understanding supervisor who actually helps the individual with a chronic disease in setting boundaries. This is frequently discussed by people or the participants in the focus groups, like actively manage their energy levels, taking breaks when needed. I had a person, he was a teacher or a drama teacher, stating that he took naps during the day. He just assigned a task to his students so he could take a nap, and that way he could really manage his work, which is maybe not applicable for every job, but every person I spoke to really had solutions to take pauses or manage your energy during the day. Also back at home, I had a person who skip the household work and hire someone to do that for her. So she was able to maintain her work or prioritize the things they wanted to do in life. So they knew that which aspects they wanted to put all their energy in, or and which aspect were less of a priority to them. Also asking for help, actively seeking out to colleagues and to the supervisor, stating what they needed, and what they wanted, so people could really facilitate them in this, also in work adaptations or performing work tasks for them. Or I actually had a person who swapped work tasks. Some work tasks were too heavy for them, and so she swapped them for other tasks during the day. Obtaining information, actively seeking for information about the disease, about regulations, about companies who would hire people with a chronic disease if they were seeking employment, about work adaptations, about types of support available. If information help people to gain control of their working life. And a big one also was having self-efficacy, believing in the qualities they had, communicating these qualities to the employer. As you see in the quote, 8 years ago during a job interview, I said, I know perfectly well that what I'm capable of. Once I'm hired, you will see that I am an extremely good worker, except that in this situation, I also have certain limitation. This was also a nurse, actually, and he had a kidney disease in which he had treatment during the night. So he was not able to perform the night shifts, but he was really enthusiastic and believed in his qualities during the day and during the evening shift. And he really communicated that to the employer, and he was hired. So, and he also stated that, as with others, that knowing your qualities, knowing your abilities, really helped them in believing in them. And also developing skills really help people. I had one people stating that he was so caught up with his chronic disease that he, after learning to cope with the disease, he took a social skills training because all the attention was put in the disease. So he needed training to learn to focus on the environment again, like the outside world. And also job application skills. How do you write an application letter? How do you talk to future employers? And just making progress step by step really helped people. With regard to the work environment, having a higher level of autonomy helped people. I had a lady who said, if a deadline I set for Friday, for me it automatically shifts to the preceding Tuesday or Wednesday, so that if I have a bad day, I can still finish it on time. So having that autonomy really helps in performing work tasks. Also, working from home is part of having autonomy, really help people, or working at times that they're able to. For Jill with rheumatic disease, well, in her case as a nurse, it's maybe difficult, but if she's able to, with the morning stiffness, start later on the day, it would maybe help her to perform her work. And obviously making adaptations to the work environment. I have people having technical adaptations in the computer, or just an adapted chair or an adapted desk, whatever they needed. So what support do they need to have those solutions found or used in daily practice? Well, a large part of the support is they really need emotional support. All people address the need for understanding, empathy, and interest from colleagues, their supervisor, and the people who got that support. It really helped them in performing work. They need help in learning to accept a disease and to gain an overview in, well, everything that comes with it. And that help is mostly given by the people back at home, friends, family. The need for understanding was mostly needed from the work environment, colleagues, supervisor, and could be facilitated by occupational health professionals by explaining to employers how important social support is. They also need an information or support in information. There are so many information available that they sometimes lose track, or they do not see the bigger picture due to that. I have people stating that there's so much support available that they lost track of what was relevant to them. So the people I spoke to stated that they need support from occupational health professionals in what is relevant for them regarding their information of the disease, of work regulations, of types of support available. And people who needed to return to work really wanted information about companies who accept people with a chronic disease, which should, at least in the Netherlands, be every company, but in practice that is unfortunately not true. And finally, instrumental support. They, as I spoke about, they need adaptations which should be paid by someone, mostly the employer, or there are other types of support available, but small adaptations could make large changes. The training programs which I mentioned about to facilitate skills or to increase their skills so that they can support the maintaining or returning to work. And with regard to the type of support, this is specified for the occupational health professionals. They indicated a need for active personal support based on the request of the individual. And one person stated, I noticed that there are many targeted solutions available, such as a specific course or a particular possibility, whereas it should be the other way around. They should listen to you and ask you what you need, what kind of help you require. Asking the question to the individual with a chronic disease is part of the solution. They also stated a need for a prepared and skilled professional. They had experiences of professionals who were less prepared or did not know the impact of their diseases, and a professional who is proactive. Well, these are the types of support or the people they need support from. So the social environment is the people back at home to learn to accept and to cope with the disease. Social supporting and understanding in work should be provided, according to the people I spoke to, by the manager and the colleagues. Providing of information, practical tips, but also contact with others can be provided by patients associations. GP or medical specialists could really is mostly contacted for advice regarding illness and work, and occupational health professionals could really help them with practical tips, information, advice to employers about the importance of social support and supporting retaining and returning to work. So this, as you remember, we have two types of physicians or occupational health professionals, occupational physicians and insurance physicians who we aim to provide with the most recent relevant information regarding chronic disease and work participation. And we see that they can really use the information in their daily practice. As first, people need to accept a chronic disease, which can be supported by their family and friends. Disclosing the disease is important, as in which they should feel safe to disclose the disease. Disclosing makes way for other solutions, and emotional, informative, and practical solutions or support is required. So occupational health professionals can really help there. With regard to the case, what can Jill do herself? So based on the solutions brought by or reported by people with a chronic disease or the participants, well, Jill had problems with accepting the chronic disease. So she, if she finds a way to accept that she has a disease, there's probably more room for other solutions. So that could be a first step. Also learning to cope with the disease and having insights in what she is able to do. Having a clear communication of boundaries to her colleagues and to her supervisor. Asking for help from colleagues. Maybe she has tasks in which she has to use her hands and she has pain in her hands. Maybe she can switch them. Maybe she can perform more desk work, or maybe she can, how do you say it? Change certain tasks. Maybe there are work adjustments available to make hard tasks lighter, and she can, by communicating her own qualities, maybe what I told earlier, start later in the day because of her morning stiffness and work only the night shift or evening shift. But also, good to mention, we focused in the research on solutions independent of a disease, but there are also solutions dependent of disease, which for rheumatic diseases are, for instance, medication, or disease-specific medication. For professionals, they can help Jill by asking Jill what solutions she has. As participants stated, that not the support should be the point of attention, but the help needed from the individual. Professional or occupational professionals can state to the colleagues and the supervisor the importance of receiving empathy and understanding, and how that can be difficult to manage at work. They can provide her with information on the disease, working with the disease, rules regarding work participation, and available forms of support. And she can, or they can provide her with skills training or tools to work with the chronic disease. So if we summarize my entire research, is that there are various personal and work-directed factors influence work participation, which if they negatively influence work participation, can be changed by work-directed interventions, at least for the work-directed factors. Well, people with a chronic disease have several solutions to retain or return to work, but support from others may be needed to find and use interventions to enhance work participation. So if we look at the wheel, we included all of the information in the guideline, which, well, unfortunately for a lot of people is in Dutch. So maybe there's an English version one day, but you can see it's actually quite the same of my as my publications. We strive to increase the capability. So the mid circle, the red circle, is the type of intervention in how to change the capability. And as we had the guideline, we focused on making a training, which you can see on the low part of the circle, to increase occupational health professionals' capability of using the information included in the guideline. So therefore, as stated, we developed a training. We developed a training including the occupational health professionals. We asked them what type of information was highly relevant for their daily practice, what could really help them in what could really help them in the guidance of people with a chronic disease, and what was not really already used in daily practice. And thereafter, we asked experts in the field of training of occupational health professionals what type of activities help in learning these type of information to the target group, which is occupational health professionals. And thereafter we performed the training. Oh, it stops. In which we found that we evaluated if the training was a feasible approach, and which we found out that it actually is the next slide. Yeah, the people really found it acceptable. They found it of value to their daily practice. They found it a contribution to their daily guidance of people with a chronic disease. They also stated that it can be implemented at a larger scale, and it has a flaw in it. It can increase their knowledge, because we measured on baseline after reading the guideline and after performing the training or following the training, and we found a significant increase in knowledge and skills after performing the training. Luckily, the training is now implemented nationally, so all occupational health professionals will receive the training so that they are able to use the information in their guidance of people with a chronic disease. So based on the information or based on the research I conducted, what can I recommend for practice? For professionals, really ask the individual themselves what they want and need. Ask the individual which solutions they already have or use or think about to retain or return to work. Provide them with support in finding and implement these solutions, and advise employers in giving the employee empathy, and facilitating the employee work adjustments. What can individuals do themselves? Well, it's easier said than done, but learn to accept and to cope with the disease, as it seems like a first step to create space for other solutions. Well, find and use solutions, maybe learn from others how they do it, such as believing in oneself, asking for help, energy management, and really believe that you have qualities of your own which are really useful for daily practice and work environments. See a professional who can provide support and information on additional interventions, what is already out there, what can really help you. And when feeling safe, explain the situation to your employer, which can facilitate you with work adaptations and work-related interventions. With regard to future research or further research, I'm really curious to which solutions, because we had quite a range of solutions, but which solution worked for whom. I think I saw a lot of people or spoke to a lot of people who had quite a large autonomy in work. So maybe not all solutions are applicable to people with lower autonomy in work. So I'm really curious about that. And I think there should be more research to the needs and wishes of individuals with a chronic disease and how occupational health professionals can really address the needs and wishes of people in their guidance. And I'm focusing on both of the aspects in my future research after obtaining my PhD. With regard to the take-home message, well, although people perceive limitations in participation in work, they generally value being able to participate in work. People have several solutions to participate in work, and I didn't say that in the results, but we also found that they are more than willing to play an active role. They want to manage their own disease and work participation. And support and guidance may be needed from professionals to support finding and using solutions to retain and return to work. So I really want to thank you for your attention. And if you have any questions, you can ask me now. I will try to answer them, or you can send me an email later on. It's addressed in the box below.
Thank you. To our audience, if you have any questions at this time, please enter them into the question box on the GoToWebinar panel, and we'll read those out loud. A few questions that came in. When helping people become conscious of their own solutions, can you talk a little more about the process? How do you get people to join the focus groups? What questions to ask?
Sorry, is it? Do you mean like how can occupational health professionals help people become conscious of solutions, or related to my focus group specifically?
In your studies, what did you find was helpful?
No, I thought it was really helpful that, well, they are conscious of mostly one solution at least, and they started talking like the most how do you call it, the outgoing person started talking about a solution, and then other people they had like an aha moment, like, oh, I also do that, and then it really helped them in because some people, they do it every day. They lose conscience of all the things they do on a daily basis, and it really helped them to gain an overview of what they do to be able to work. Does it make it clear? Or
another question that came in your research, were the focus groups a success? And if so, based on which factors? Did you see any opportunities for improvements in the focus groups?
Well, yeah. I think they are a success in the way that people felt safe to disclose their used solutions, and it was. I learned a lot, and people left feeling safe and okay. So that's successful, and we also obtained data saturation, which is regarding research also a success. What I learned during the focus groups is, for me at least, in research, they mostly focus on containing 6 to 10 people per focus group. But I included 4 to 5 because there's like 2 hours is limited time for 10 people even to speak, like for a short amount of time. So it's not like we did interviews, but there's like a balance between not speaking at all or having time to speak in 2 hours. So I think 4 to 5 people is great, and I would use that for next time as well.
I think that's all the questions from our audience at this time. Is there anything you would like to add following your presentation, Marloes?
Maybe it's good to know for the audience that if they're interested in this topic, I'm luckily I will do my defense in 2 weeks, and now I am a researcher continuing in this line of research. So if they're interested, there are more publications to come, and mainly focus is this topic. And thanks for listening, obviously.
And thank you so much for your presentation.